To thank everyone for being here today. We've been working tirelessly, a broad coalition, to try and build an effective mental health and substance abuse system to help those who are most in need. Tackling our behavioral health challenges, investing in a regional, integrated, coordinated system of care as a county supervisor is my single highest priority. With bold thinking, a willingness to approach things differently, we are striving to have progress through partnership. We're striving to take action to reimagine and fix our behavioral health system. To do that, we have to not only reimagine how services are provided, we have to rebuild the partnerships that provide them. And if we do that, we can begin to help restore the lives who are most in need. A cornerstone of this new system is the regional hub, one location with an array of services that are co-located and coordinated. The Central Regional Behavioral Health Hub to be built on this site will be the anchor for our county, a true one-stop shop, connecting individuals to step-down services and care coordination, long-term care plan that will set them on a path to stability, keep them out of our hospitals and jail, and achieve better long-term outcomes for patients and for quality of life. Today we are here to announce that a county feasibility study has been completed and determined that this location is the ideal location for a center that is co-located and affiliated with general acute care hospitals, those who are right here in this region and standing with us here today. That is facilitating transitions for patients that arrive in nearby emergency rooms more conveniently. This would be a facility that would have inpatient acute psychiatric beds. I would like to see as many as 60 on this location. While we strive to reduce the regional need for inpatient psychiatric beds by better services and by better outcomes and better care coordination and better follow-up, we still have a need to have these. And if we're going to have them, they are best served when they are co-located with an array of other services. This location should also include a crisis stabilization unit. It should include a receiving center for those who are being discharged from hospitals or jails to come here and get on that path to recovery, detox and sobering facilities, substance abuse treatment programs, step-down recuperative and medical recuperative care beds, intensive outpatient services, and all of this being done in care coordination that is designed to be linked to the person in a long-term way to guide and manage the care to varying levels for that individual on their path to recovery. And that includes a warm handoff to community services that may be available, along with tracking the placement of these folks in the appropriate level of housing to ensure their ongoing success. And all of this must be done across shared data platforms, with service providers having access to one set of facts and inputs surrounding that individual, where they are, and the help and care that they're getting. The current estimates are that this facility will cost $115 million to construct. This represents a serious investment towards our regional needs. The report back on this will be presented to the Board of Supervisors tomorrow. But we have to all work together. The County of San Diego standing alone cannot solve this challenge. Our hospital system standing alone cannot solve this challenge. Our community services and providers standing alone cannot solve this challenge. It takes all of us standing together. It takes all of us working together. And I'm pleased to share with you that our plans for this $115 million regional hub is to be a joint effort of the County of San Diego, UC San Diego Health, and Scripps Health. We are working together to make a shared investment in a shared facility with shared values and a shared mission, one that provides the world-class care that the residents of San Diego deserve. Agreements with our hospital partner is integral to this new venture, and us working together is integral to getting the outcomes that we need. Arriving at an agreement with UC San Diego Health and Scripps Health to jointly operate and provide services at the hub, as well as services at the San Diego Psychiatric Hospital, will unlock new dollars to help fund the construction of this facility and also create the potential to establish a new pipeline of behavioral health workers. We are currently negotiating the details of a joint agreement. It is my hope and my expectation that a finalized agreement can be reached by January so that we can get to work building out our regional system. This is a significant investment. This is a complicated issue. It is not easy, but I know that there is a strong will to get this done. I know the County of San Diego is committed, and I know the leadership of UC San Diego Health and Scripps Health are as well. As we move forward and how we work together, we aren't concerned about the past. We are concerned about how we move forward together. We have a ways to go to bring this concept to fruition, and I want to reiterate that the path ahead is not an easy one. This would be a historic agreement for our region, something that hasn't been done. But it is something that is doable. The only way we can realize a new path and a new vision is for all of us to come together and to work differently than we have in the past. I am thrilled that in the central region we have 2 hospital systems that believe in this path, that are willing to work with us as partners and make it a reality for the patients that we jointly serve in a new and coordinated way. Standing with me today, UC San Diego Health CEO Patty Mason and Tom Gamir, Corporate Senior Vice President and Regional Chief Executive, Scripps Health. They are strategizing with us to bring the hub and our coordinated visions to fruition. It is our goal to create a partnership that brings them on to jointly invest and jointly help us operate the facilities here. Over the past year, we have been working faithfully with UC San Diego Health on transforming the operations of the County Psychiatric Hospital to bring it under their license, an opportunity that would unlock up to $20 million in Medi-Cal dollars annually, money that can be reinvested in our local behavioral health system. I appreciate Patty, and I appreciate UC San Diego Health for your ongoing efforts and participation over the last year on working to a solution. I know that we're not quite there, but I know that we can get there. I know that we can get this done. We are also incredibly grateful for Scripps Health now joining this joint effort. Scripps is currently proposing to bring in more capacity in South County, but San Diego and the central region is still in need of additional inpatient beds and other services for the vulnerable populations. And I appreciate Scripps Health being here with us and making sure that the needs of this region are taken into account as we address the entire region. As I said before, this isn't going to be easy, but it's possible to make progress through partnership. And if anyone can do it, it is this group of folks. I also want to thank the support of our county, both of my colleagues on the Board of Supervisors, but also the senior county leadership. Our Chief Administrative Officer, Helen Robbins-Myers, our Health and Human Services leader, Nick Mancione, and our Behavioral Health Director, Dr. Luke Bergman, are committed to this effort, and I appreciate their tireless work. When I took office this year, the beginning of this year, this land behind us was slated to be luxury condos. It was close to completion in terms of an RFP to build luxury condos. But thanks to the support of my colleagues on the Board of Supervisors, it is now on the road to being the flagship of a network of regional hubs. We will simultaneously work to identify 3 other locations throughout the county that can serve this same purpose in a distributed regional fashion. The hub concept we introduced will become the cornerstone of a new regional behavioral system and connect seamlessly to other services in the community. It will enable us to shift from being a crisis response system to a chronic care management system. Sadly, right now, we have, in a lot of ways, a fragmented, disorganized, disjointed, and uncoordinated system. When a person has a mental health event, there is no place for them to get the immediate help when they are in crisis and manifesting symptoms other than to call 911. As we all know, public safety and emergency services have become our mental health first responders. Last year alone, there were 54,000 911-related PERT calls. Our public safety partners are doing a great job under these challenging circumstances, but this is not their area of expertise, and their options are limited. They take you to the emergency room, or they take you to jail. In the current behavioral health model, the cycle of episodic stays in inpatient care in jails continues, with the individuals getting stabilized, released, back to where they were, until they have another episode, and they cycle through. One day in the San Diego jail system is over $10,000. One day in a hospital is $12,000. Annually, the county invests $60 million of discretionary behavioral health services to crisis care. The model that we are outlining here can help break this cycle. We can make substantive, meaningful progress. Since taking office, we've been collaborating with folks from throughout the behavioral health community, many of whom are here today. Many of the folks who are here, standing here today, are not associated with the county, or with UC, or with Scripps, but they know that we're all in this together, that we all have to support one another in playing our role and our part to try and make this work together. Through these processes, we've been seeking input and advice on how to break apart the old model and build a coordinated regional system that meets the needs of our most vulnerable systems, not just responding to the demands of a fragmented system. We want to flip the paradigm and redirect the dollars that are currently being focused on crisis emergency part of behavioral health system and redirect them to enhance community-based care that promotes better outcomes. With the hub, we will have a physical location that a person in mental health crisis can get an assessment and connected to on-site the appropriate level of care to meet their needs. The right person getting the right care at the right time in a truly integrated model. Besides this hub, which is the physical manifestation of a new system, there are several policies and programs that we've identified through this process we'll be unveiling in the near future, including developing non-law enforcement outreach teams, enhanced care coordination across systems, better integration of data with our community partners, tackling the workforce challenges, and making policy changes to address the fragmented Medi-Cal delivery system, to name a few. But on this path to reform, rebuild, and restoration, we have many partners. None of them are better or more committed than Patty Mason, the CEO of UC San Diego Health. As I mentioned, she's been at the table for more than a year working with us to transition our county psychiatric hospital and bring it under their license. Patty and UC San Diego Health are a great partner, and they've been a great friend. I appreciate their work, and I look forward to continuing to work, and I'm pleased to have them here. So please join me in welcoming Patty Mason, CEO of UC San Diego Health.
Thank you, Supervisor Fletcher, and many thanks to all of you joining us today. What Supervisor Fletcher is sharing is promising news of an emerging collaboration that could strengthen psychiatric services in San Diego, especially for our Hillcrest and downtown areas. By having Scripps Health join the discussion, we can continue conversations that began more than a year ago between UC San Diego and the county to evaluate all of the possibilities for a behavioral health hub. As you can imagine, many complicated factors will come into play as we develop this potential plan, from hospital licensing issues and operations to legal and regulatory requirements. But now with Scripps at the table, we have an even larger pool of experts and resources to support the community. And as you heard, with a force of nature, which is Supervisor Fletcher, we're going to find ways to get through these issues. But it is complicated, and we'll continue to work at it. At the end of the day, what's important is that we come up with a productive solution that protects and helps one of the San Diego's most vulnerable populations. My belief has always been that if we work together to focus on the needs of our patients, we can develop something extraordinary in the region. What I've been asking my colleagues is, if not us, who? Who's going to be at the table to help us put this together? We can do something that is extraordinary, that will be a best practice across the nation if we do it right. So we continue to be committed to put this together, and I'm thrilled with my friend Tom Gamir, my colleague at Scripps Health, to become part of this process with us. Thank you.
Thank you, Patty. And again, we're incredibly grateful for Scripps Health joining this effort. Scripps Health is proposing to bring in more capacity in South County, as I mentioned earlier, but we're still in need of additional inpatient beds here. And we appreciate their commitment to keep these vitally needed services in this area. And again, when you take the county, you take UC San Diego Health, you take Scripps Health, you get us all moving forward together. It is a tremendous coalition that can have a tremendous impact. So please join me in welcoming Tom Gamir, Corporate Senior Vice President and Regional Chief Executive at Scripps Health.
Thank you, Supervisor Fletcher. This place, it's so close, I actually walked over from Scripps. It's not very far, which is ideal. It's kind of, this site is co-located with UCSD and Scripps and creates a really unique opportunity. I'm here on behalf of Chris Van Gorder, our President and CEO of Scripps Health, and the entire Scripps family. And we applaud the county for kind of leading this effort to take action to address these behavioral health needs in our community. We support the direction that the county is taking on this location in 3rd Avenue and the potential to build a behavioral health hub here in this location. We are encouraged that we have been invited to join the conversation that has been going on for over a year between the county and UCSD, and thanks to both of them to leading us to this point in time to develop this plan. This is a unique opportunity, it's been said, to do something here in Hillcrest that is really could be a regional resource that could help fill the gaps for the vulnerable San Diegans who need behavioral health services in our community. As you know, Scripps is a nonprofit health system serving the entirety of San Diego, and Scripps serves a high number of underinsured and uninsured patient populations that need behavioral health services and programs. And as has been said, it affects our emergency rooms and our overall services provided. As such, we are grateful for the county leadership and willingness to make these important investments in behavioral health services. We've said this many times, that we believe that behavioral health crisis is the #1 issue impacting healthcare providers in our community at large. All of our healthcare systems in San Diego, communities and families are impacted by this crisis. Solutions are not easy, as it was said, and we've got a lot of work to do to create this solution. We believe the need for behavioral health services in San Diego spans the gamut more than inpatient beds into post-acute, and we thank the county for their efforts to address the post-acute issues. Better care coordination, more outpatient and supportive services, a network of care, so to speak, that would serve all the needs of the patients. This is why Scripps is also investing, as has been said, in other parts of the region that are desperately in need of these services. In conclusion, I'd like to say that we need the county to do exactly what it is doing, stepping in to fund and facilitate solutions to the behavioral health crisis affecting our region. This issue deserves the attention it is receiving. So we thank you. We look forward to now being part of these important conversations, and we are optimistic that working together we can achieve important results through the county's 3rd Avenue and this behavioral health hub. Thank you.
Thank you, Tom. Thank you. I want to reiterate my appreciation of both of these hospitals who came to the table, who said we want to be a part of a solution, we want to work with you. And I think having partners like that throughout the behavioral health space is what we need, and it's where we're going to go. Next up, I want to introduce someone who was the originator or genesis of the idea of utilizing this facility. It was a little bit over a year ago that I was not yet a county supervisor, and City Council member Chris Ward called and said, hey, the county's got this property in Hillcrest at the end of 3rd Avenue. It's got a chain link fence around it. It's a dilapidated building. We ought to be using this to tackle these challenges and problems. And so we came out here and we looked, and we stood together. We didn't have the keys to the gate. We couldn't open the gate, so we stood outside the gate, and we stood and we said, hey, we can do better. We can do better. We said that there may be a lot of pressing challenges in San Diego County, but a shortage of luxury condos is not one of those challenges. And this is what it ought to be. And so I am so grateful and appreciative to Councilmember Chris Ward, who brought this idea, who has stood with us every step of the way. This is in the heart of his district. He and I serve together. He's the chair of the Regional Task Force on Homeless. I'm the vice chair. And we work every day to figure out what we can do to tackle the challenge of homelessness. And the behavioral health system is a key component of that. That alone will not solve the totality of it, but it's a key component. And so I appreciate Chris for seeing the potential and the opportunity here, for bringing it to our attention. And I appreciate his continued efforts to support us as we move forward. And I want to say that siting of behavioral health facilities are not easy. It is well documented the challenges that you have just citing affordable housing. When you talk about citing psychiatric services and drug treatment services and those types of things, it's even greater. And so to have a partner who also represents the same geographic area, who's been steadfast in his support, is greatly appreciated. So please join me in welcoming my friend, Councilmember Chris Ward.
Thank you, Supervisor Fletcher. And good morning, everybody. And as a council member for District 3, like Supervisor Fletcher, I've made addressing homelessness, my #1 priority. And as a council member for this neighborhood and the chair of our regional task force on the homeless, there is real opportunity to make meaningful change to our continuum of care, to build the housing and the programs that we need to truly address this crisis. As you heard, it wasn't long ago that Supervisor Fletcher and I stood here together urging the county to use this property for something that the community actually needs. And as in his first year as our supervisor, he was able to stop that RFP process, switch it from luxury condos into an opportunity site that really addresses the crisis that we have here in our neighborhood. It's a shared vision to build a regional hub for behavioral health, and today we are making tangible steps towards making that happen. 2 weeks ago, our City Council passed unanimously the Comprehensive Community Action Plan on Homelessness. Led by